Hello and welcome. It's 10 a.m. Eastern and 3 p.m. in the UK, and it is time for Stephen on OneStream Live. I'm just getting ready behind the scenes, waiting for the video to appear on YouTube, and should do in a second or two. It has. Right, so all is good. So I can now appear on screen. 3, 2, 1. Hello and welcome. I've just had a comment from my good friend Alec Dorling, who's in Sweden, and he said that this would be interesting and challenging. I accept the challenge, and we're going to talk about the topic of the day, which is healthcare goes live. Now, it's healthcare and fitness. We're going to be looking at how fitness studios use live video and recorded video, and it's going to be an interesting session. I want to say thank you. I'm just actually going to connect the chat. So remember to do it this time. Normally I forget until much later in the broadcast. Okay, and here's my comment to Alec that challenging is a good choice, Alec, in terms of today's broadcast. Sometimes you're actually asked to broadcast about things which you've got to research, and I've been researching. So let's have a look at what we're going to be talking about today. I'm going to bring this on stream. And second, if I go from here, I've done that, and I'm going to go and put it on the big screen. Okay, so we're talking about live streaming in healthcare, benefits and challenges. And this is the introduction that you're listening to now, but we're going to be talking about the benefits of live streaming in healthcare. One is enhancing patient education and engagement, facilitating remote consultations and therapy sessions, and hosting live Q&A with health experts. The challenges are staying within privacy guidelines and the HIPAA compliance with regards to medical records. We've got the technical side to consider with the equipment setup, and then the best practices for engaging a live audience where you are doing a live Q&A session with health experts. Then the final section is live streaming for health and fitness professionals, and that's tips for creating dynamic and informative live workouts, strategies to monetize your live fitness sessions, and building an online community around your expertise. So that is basically looking at live streaming in healthcare, which is what we're all about today. Now, there's been a big increase in the use of live video in healthcare in recent years. And we're just seeing now, if you were to go in most countries now, if you go and type in telemedicine, then you'll be given a list of providers of telemedicine. Increasingly, doctors are actually visiting you, or you're visiting them. Remember the old days where you had to make an appointment, you had to walk to the doctors, you had to sit in the surgery, watch the adverts, and then you were seen, and then you had to go and get your medication. That has totally changed and totally been automated. If you think about Australia, Australia has had mobile doctors since the Flying Doctor. If you ever remember the Flying Doctor, some places are so remote in Australia that the only way that a doctor could actually visit his patients was by flying. So that brought into being the Flying Doctor service. And this is the next evolution of it. And I've just been reminded that I'm live, which is good. So let's just have a look. What I'm going to do is I'm going to go here. And I want to go, let's do it this way. I want to switch that up to here. I've done it. Okay. So what I'm going to do is put my glasses on so I can actually read it with you. If you have any questions, then please do say. And I'll try my best to answer them. It might not be whilst I'm live. I might answer them afterwards. But I do want to say thank you for joining me on YouTube live today on the OneStream live channel as we explore live streaming in healthcare. Now, the benefits of live streaming in healthcare are obvious when you think about the large distances that either doctors or patients had to travel, and now it can all be done by telemedicine. And basically, the idea is that you go onto a website for a provider, and you can actually book an appointment, and you don't have to go anywhere at all. You can stay at home, and you can have a video consultation with a doctor. Make the appointment, start the consultation, and you can ask, some of the systems say you can ask as many questions as you like within the following 24 hours. So we're seeing a sea change in the way that medical services are provided. We're not now restricted to actually visiting in person. We can actually do it over the internet via live video. And it does enhance patient education and engagement, because not only can you do a one-to-one with your doctor, but your doctor can go live and talk about anything and everything. Okay, providing that they're careful in terms of privacy, they can talk about, they could be talking about COVID, they could be talking about flu, they could be talking about diabetes, they could be talking about anything which educates us. Your doctor has the ability now, and your health service have the ability now to actually go live and broadcast educational information about your health, whether it be health and fitness, whether it be a particular problem that people have, then the ability to actually broadcast live is there and can be used at any point in time. I just talked a moment ago about facilitating remote consultations and therapy sessions. Remote consultations. It may seem strange that you're talking to somebody on video and they're able to help you with your illness or problem, but it's going to become the norm. It's definitely becoming the norm, and more of us will be using telemedicine to actually see our doctors. And the thing is, you're not restricted to your local doctor. You could actually get expert advice in any area. If you want advice about back pain, then you go to a specialist in back pain. Now, it has to be said that these services are chargeable, and you can even go to Amazon Health, and Amazon Health will help you to find the right person near you who can actually help. So Amazon have taken a foothold in this industry, which means if Amazon get involved, if Amazon are getting involved, then basically is a growing area. You know that Amazon are brilliant at marketing, and they are marketing the services of doctors and health specialists around the globe through their website. And you can, if you've got a problem, you can simply go and ask somebody, okay, describe your problem or select you. Basically, so easy. You've got a grid of 90 icons, each of which is for a different area of health. You can click the icon, you can then see who provides the service, you can see their rates, and you can select somebody to talk to for 10 minutes. 10 minutes is the normal consultation time. Over that, it increases. I know for $25, 25 Australian dollars, you can talk to an Australian medic. It's all there. Now, the benefits of doing this, if I go, let's go to the benefits, because we want to know why this is happening. And it's happening simply because, I'm just changing something there. Okay. The first major benefit of live streaming in healthcare is accessibility. In other words, if you've got a computer, if you've got a mobile phone, you can access health services globally. You're not restricted to using your own country, because this is the internet. You can talk to a doctor in New Zealand, or a doctor in Australia, or a doctor in Hong Kong. The list is endless. So accessibility, it means doctors are literally on call whenever you need them. Next thing is education and training. This is the doctors actually providing the service of education and training. As I said a moment ago, they can, from their own surgery, broadcast about health matters on any topic, and you can watch live, and they can broadcast to Facebook, to YouTube, to Twitter, to Twitch, providing they are aware of patient confidentiality. Trying to get my tongue around that was difficult. Then all is well. So education and training, I can see the major teaching hospitals actually teaching doctors or trainee doctors, and then repeating that as a public service. So they could record the session once with doctors asking questions, and then they could actually rebroadcast that so they'll see it. We should be able to be told. So if I, for instance, have diabetes and I watch private individuals talking about diabetes, but it'd be good if in England, the NHS could actually broadcast about it as well. I mean, I know they do use video. The NHS use video. I remember of the diabetic group on the NHS, and there are videos there, and there are live sessions as well, Q&A. So a combination of private and public services for health education. Right, patient engagement and empowerment. The number of times this is a genuine problem. Trying to get a doctor's appointment is not the easiest thing to do. Trying to get a hospital appointment is not the easiest thing to do. No matter which country you're in, our health services are strained because the demographics in each country are changing. Population growth is going down. The average couple in the UK now have 1.2 children. We need for everybody to have 2.1 children in order to stay the same. So we're not going to see population growth. At some point, we're going to see population falling. But at the moment, we've got the problems of growth. And with growth comes the fact that there are more older people who need help with their health. And elderly people can't travel. Some elderly people would find it difficult. We've got to go into Swindon, which is about 25 miles away. We go to Bath, we go to Bristol. I had to go to Bristol Royal Infirmary, which is an hour and a quarter away from where we live. But getting hold of people has always been difficult. Now, with the use of telemedicine, you can get a 10-minute consultation with your doctor or with a locum and discover more, get your questions answered. And if they could have group sessions as well, that would be absolutely brilliant. So education and training, patient engagement and empowerment. And it is empowering if you can book an appointment with your doctor and you don't have to leave the house, and you can basically have a private one-to-one. And the thing about the whole of this is that communication now is very secure. Okay, it is a private one-to-one consultation. Nobody else can listen in. Nobody's going to hack. It is totally secure. The signal that you send to your doctor is secured at your end and decrypted at the doctor's end, and vice versa. So both video signals are actually encrypted and decrypted, so nobody can intercept them. So when you arrange a private appointment with your doctor on video, it is private. Simple as that. Now, over time, more and more medical practices will get involved. It's in its infancy, bear that in mind. If you're in Australia or the USA, just type in telemedicine and you'll see a wide range of services that you can actually use. And if you go to amazon.com health, then you can actually book it via Amazon. Continuing medical education. I said a moment ago that you have teaching hospitals who are teaching and training doctors, and they're doing that on a daily basis, and they're explaining to doctors the ramifications of certain health conditions so that doctors can then learn all about it and then can treat us. Now, what we could do and what could happen is that medical education, the doctors don't have to go to Bristol to get it. They can join a teleconference of doctors. I'm saying Bristol as an example. I'm not sure what is actually happening, but it could. They can join a group of doctors learning about various topics. And that basically without having to move, to be brought up to date. I mean, if these sessions took place after the close of doctors' surgeries, then continuing education is definitely a great use of live video. Now, the other thing that we're dependent on is continuing research and collaboration. Doctors can, through the medium of live video, actually talk to each other wherever they are in the world. So experts in each country can talk to experts in another country on a secure line, and they can see each other, they can get to know each other, they can effectively they can network. Networking for doctors is a good thing, because if they get to know more about the diseases that they're treating, it's a win-win situation, because some of the doctors will not have knowledge of A, some of the doctors will have knowledge of B. They can exchange information, research, and we need research, we need medical research. And the fact that we have video, be it on Zoom or be it on OneStream, means that doctors can get together and talk. Within OneStream, you can actually have 10 doctors on screen at the same time, all talking, and all they need is an internet connection. And that's it. They can come in via mobile, they can come in via tablet, they can come in via PC or Mac. Research and collaboration. So the benefits of live streaming in healthcare are accessibility. You just need a phone or a computer. Education and training. It is great for educating us. Doctors can, if they wish, go live on Facebook, YouTube, Twitter, and Twitch, and educators. They would have to adopt a particular approach, which I'm sure the medical profession has prescribed. That's a good word. And they will then be able to educate us. Because if we come to seasonal diseases like flu, like COVID, like avian flu, then if our doctor would actually go live and talk about it, we'd be better informed. And the more informed we are, the easier it is to actually cope with the situation we're in. Patient engagement and empowerment, the ability to have one-to-one with your doctor without visiting the surgery, over the internet, secured at both ends. And it is empowering because, as I say, trying to get a physical visit with your doctor is difficult. If you think about the logistics of this, if you get an appointment with your doctor, you have to travel to the surgery, and the surgery may be 30 minutes away, or it may be 90 minutes away. Then you have to sit in the waiting room, because you always get there early. You've got to sit in the waiting room with other people who may be contagious and not know it. I'm not spreading rumors here. I'm just saying you don't know who's in the room. Then you go and have your appointment. Then you come out for your appointment. You've got to go back home again. With telemedicine, you can actually book an appointment online talk to your doctor for 10 minutes, ask questions for the next 24 hours, and you're getting as good a service as if you went there, or almost as good a service as if you went there in person. So telemedicine will replace a fair number of appointments over time. Okay, and that's the empowerment side. The empowerment is that because your doctor can now do 4 or 5 video conversations in an hour, rather than seeing fewer patients in that time, then that it actually frees people up. It frees you, and it frees your doctor as well. Because if they say, right, teleconsultations are between 10 and 12 o'clock and 3 and 5 o'clock, the rest of their day they can carry on as normal, but they're actually doing telephone consultations in that time. Continuing medical education, as I said, you could have people joining the education programs from around the world. So we are global, and information that is difficult to get in some countries could now be supplied via live video to an invited audience who've got a password, and it's totally secure, and they can go and learn about the latest technology or get their questions answered on any range of topics. And finally, research and collaboration is the ability for people around the globe, for doctors around the globe, for developers of medicines around the globe to actually get together and work out what they can do to help us and to cure disease. I mean, health is, I can speak from, health is something that we take for granted, and we shouldn't. Live video is the ability to actually be in contact with a well-informed doctor. Okay, and that doctor doesn't have to be from your local surgery. If you're willing to pay, in Australia, the charge, I say, was 25 Australian dollars, which is about £12.50, which is roughly $15 for a 10-minute consultation, and save time. Okay, right, back to because we chock-a-block with questions and information today, and I'm now going to go here, and we're going to go back to our script, and basically I think we've covered option 1, benefits of live streaming in healthcare, enhance patient education and engagement, facilitate remote consultations and therapy sessions, and host live Q&A sessions with health experts. And that basically is the crux of it all, that we now have the ability to communicate without travel. And that's the game changer, is that you don't have to leave where you are to talk to your fellow health specialists or to talk to your doctor or consultant. Right, now, it's not without its challenges. The health departments in every single country around the globe have put together a code of conduct for doctors when making exchanges with patients. The patient has to give permission. Okay, although it's totally secure, although it's private, there has to be an understanding that the patient agrees to discuss their medical record on screen. Now, the HIPAA is both, I know from checking, the HIPAA is both in USA and the UK. We've got different versions of it. I dare say it's available in every country to protect the privacy of patients. Now, technical considerations and other things. Okay. In order to have the best broadcast ever, whether it's one-to-one doctor-patient, or whether it's doctor-to-doctor, whether it's broadcasting to a number of patients at the same time. If you do broadcast a number of patients at the same time, don't mention patients. Okay, do not use any medical information on air unless you have explicit permission. But you need the right equipment. Now you could, well, let's just go with this. You could do it all from your mobile phone. Okay, you could actually broadcast from your mobile phone, but that's not ideal. Okay, what you want is you want to present a professional approach, and that professional approach is to have an external camera and external microphone. As we know in live broadcasting, sound is so important, and getting the right microphone as well. I mean, I've got 3 here, and I switch between them depending on my mood, but they're all high quality in terms of sound. You've got to get the sound perfect, because people will listen to you. Because if you're just a one-to-one situation, they're going to get distracted, but if they're listening, that's good. So you want a microphone which is high quality. And talking of the Blue Yeti, Audio Technica, or the Elgato Wave, all of those are my choices, but you can spend between 60 and hundreds of pounds or dollars. It's up to you. The next thing is the camera. You do need an external camera. Mine is the Nexigo, which is I'm looking directly at it, and basically it's a 4K camera which is giving high quality. And it does mean that when I show something on screen, I'm just going to switch for a moment, because you probably guessed by now, I am actually using a green screen, and that's the green screen behind me. Using green screen software helps, because especially if you're doing consultations from home, if you've got a background, just looking for one, just a minute, I'll find one, don't go anywhere. We're talking about presentation and getting the presentation right. You could have a photograph which relaxes everybody, okay, and this will be here in a moment. Water always calms people down. For your information, this is Holt Garden in Wiltshire. So camera, external camera, either you've got the Logitech C920, you've got the Brio, any external camera is going to give you a good quality picture. And the other thing that matters as well is lighting. Yeah, if you're presenting, then you want your room to be well lit. I mean, I'm lucky today because I'm broadcasting in daylight. I've just got the daylight on me. If you're broadcasting in the evening, then what you actually need is lighting. And basically what I'm going to say is what you should do is you should check out, okay, you should check out how your lighting looks and use a color like this to check whether the lighting is good. If you're going to use background removal software, then do. I'm using vcam.ai today, vcam.ai, to actually do this, and this makes it, well, I think it makes it more interesting for the person who's watching, because you're able to mix it up, and if people are talking to you, then they don't have to see your office. Yeah, you could show the office behind you if you wanted, but you can also have any image behind you whilst you're talking. Yeah, we're talking about live streaming in healthcare, benefits and challenges, and I'm going to add this to the stream, replace the media, and go full screen. So you're listening. Stephen Healy, live from Wiltshire in England. If you're listening live on YouTube, I'd like to say thank you. If you're watching the replay, I'd like to say thank you. If you've got any questions about healthcare, then please do ask. Now, I do want to state at this point, perhaps I should have done it at the beginning of the program, I am not a healthcare professional. What you're getting is Stephen's view on healthcare and live streaming. That's what we're talking about today, my view. Okay, so this is not by any stretch of the imagination information to, well, it's obviously interesting, I hope. I'm going to come back and go here and go here. So equipment wise, you do need to have camera, microphone, and your lighting. In addition to that, you need a service to use. Now, OneStream is a brilliant way of actually broadcasting, because the thing is, with OneStream Stream Live, yeah, you can have a private hosted web page, and you can broadcast the web page. Now, you can either make it totally private and password protect it, or you can open it to the public. If you're providing health information and you want more people to see it, then without building a website, you can have up to 5 pages, depending on your plan, on OneStream Live, hosted by OneStream Live, where you can set things up so you can go live on the website and people can watch you. That's key. OneStream Live, it says it up there. So OneStream Live is telemedicine friendly. Yeah. If you're doing a seminar, OneStream Live. If you're broadcasting to a web page publicly, OneStream Live. If you're holding a private patient group, then you can bring them into the studio. Yeah, we can have on screen, let's just go here. We can have on screen up to 10 people in the broadcast. And also, if we can have 10 people, we can have one. And OneStream is perfect for one-to-one discussions. Totally secure, end-to-end, encrypted, and the invite you send changes every time. So you can have a private one-to-one session without going live. Yeah. And the key here is that you could have the one-to-one session without going live, and you could record it. Now, the recording you could send to your patient afterwards. Because the thing is that when people contact a medic, they're flustered. With the best will in the world, we're not thinking clearly. So if you actually record the session and password protect the recording, you can send the recording to your patient so they can replay it at any time. As I said, with telemedicine, you pay a one-off fee and then you can ask questions for the following 24 hours in text. So these are opportunities for doctors to engage in telemedicine. Obviously, you have to be a licensed practitioner, and HIP AA will tell you who can, what they can do, what they should do. It's all protected. Okay, the communications between doctor and patient are protected, and you've got to go with the guidelines. Okay. Best practices for engaging a live audience. If you are going to go live on your website and you're going to broadcast about flu or about avian flu or about measles, and you're broadcasting to the world, to engage your audience is basically, well, I'm going to say engaging an audience is an art form, and it's literally art. It's basically bringing in, and I'm going to bring this in here and reply. I'm going to go down here and I'm going to switch things around. If you can bring in images, you can engage your audience. So if you've got a slideshow, then you can bring that in. If you've got images, you can bring those in. If you've got documents, you can bring those in. Sharing wise, you can share images, videos, and the screen. I'm going to do a screen share in a moment. So if I bring this document back in, it will disappear the other one. So presentation wise, you can do a range of things to engage your audience. And if it's a Q&A session, then within the OneStream Live Studio, you've got the ability to answer those queries, whether they're on the web page or on YouTube or Facebook. Okay, now this title here, live streaming in healthcare and benefits and challenges, also includes health and fitness professionals. Now, my partner Angelica decided to join a local fitness center 18-20 months ago in order to become fitter. And we're talking about strength training here, about core training. And we're very fortunate that in Wiltshire we have Fruity Fitness, who have studios in Devizes, Chippenham and Marlborough. And I'm going to show you a little bit about them. I'm going to, if I just go over here, I'm just checking something. Okay, so the chat is quiet at the moment. I'm going to share screen. So let me go down to share. I'm going to talk about the use of video in fitness training. So I'm bringing that in now. I'm going to come here. Now, the company that Angelica chose, I'm just going to close that. The company that Angelica chose is the one that you can see above, which is, I'm going to scroll down. The name is not immediately apparent. If I go to about, let's see what that says. It's about the Frucci team. So this is a team of people. Matt Frucci is a qualified PT and registered nutritionist. Mike Sweeney, Katie Pierce, Julie Cable, Bindu Ratan, Chloe Carrot, and these people are involved actually helping you with your fitness. Now, Matt, who I'm going to be interviewing shortly, is a great believer in using video in his business. He runs 3 fitness centers with his team, and he uses video to actually interview his clients. The greatest recommendation you can have is when one of your clients refers you. But this is one step beyond that. Matt is in this video here on the right, and he's actually talking to Deborah. And this is something that he does. He uses video to record. Sorry, the gym is for ladies over 40, and they enjoy being interviewed by Matt, and the videos are then put onto YouTube. So this is the recommendations for the services of Frucci Fitness, and you've got people in the gym there, and you have basically, I've got to say that the people who go to Frucci Fit actually enjoy going there, totally enjoy going there, exercising, 30-minute sessions, and you can go 1, 2, or 3 times a week, depending on the plan that you have. But the interviews are just natural. And Matt Frucci is the CEO. And here we have some before and after photographs of the gym. And it's all using and promoting with live video. And Matt does regular videos, training videos, for people who are there. And we've seen the use of YouTube. We're now seeing the use of Zoom. And I'm going to switch him over to OneStream at some point. But all these videos are over on YouTube and are testament to the effectiveness of Frucci Fit. And I love the way that the interviews take place in the gym. And there are the staff we spoke about a moment ago. And you can join, you pay a monthly fee, and for that monthly fee you can train 1, 2, or 3 times a week. And when you train, you're actually training with a qualified trainer. So video wise, Frucci Fit use live sessions, interviewing their customers, interviewing their staff. They use live sessions on a regular basis, different aspects of the training that their clients can take part in. Everything, he makes great use of video, which is why I'm looking forward to interviewing Matt later this week. Because, and the reason I'm interviewing Matt is that Fruity Fit has sponsored my partner Angelica in the London Marathon, which is 21st of April. I'll be there, Angelica will be there, of course, to run the 26 miles, 385 yards. But Fruity Fit has sponsored Angelica. And as a thank you, I'm going to do a 30-minute interview with Matt Fruity of Fruity Fit about his business. And that we're arranging right now. It's being arranged so that I will interview Matt about his fitness studios, about the fitness journey his clients go on, how he got involved, what his background is. All of that will be on, don't know whether we're going to record or live yet, but it'll be on a live video in the next couple of weeks. Well, before the 21st of April, I would think, pretty soon. So I want to wish Angelica every success, and I'm looking forward to interviewing Matt. And as I say, Matt makes great use of, if I can go down here and find the bit I'm looking for, just a minute. I've got a screen share there. I'm going to put it full screen so you can actually see it. We're going to go back up the page. So this is the use of video in fitness training with the trainers and their leader, Matt, their clients who are happy to talk about their experiences within Fruity Fit, and the training programs that are put together for each individual who takes part. And you can see all these videos on YouTube, and there's Fruity, and you just need to add fit and you'll find the videos on YouTube. Zoom calls as well. And it's just a great example of the use of live and recorded video in a business, because these are recommendations, these are testimonials from people who are actually clients of Fruity Fit. And this webpage tells you all about Fruity Fit and how to get started. And if you go to the YouTube channel, then you can see all the videos on the YouTube channel been made over the years. And it is a great use of video in fitness. And we come back to the top. And the logo is very small, it's very subtle. It's not screaming out at you. The logo top corner is not screaming out at you, but it is Fruity. Okay, so that's fitness. That's Fruity Fit. And I'm going to stop sharing. Okay, and we're back in the studio now. And what I'm going to do now is a recap of what we've been talking about. And first of all, I just want to take this, put this on screen and replace. And I'm going to put it here. And I'm going to go here. The use of live streaming in healthcare is on the increase. Certainly, I looked at the Australian sites that you can have a call with a doctor for 10 minutes for 25 Australian dollars, about 15 US dollars, and you can have a follow-up. And this is a growth area because, well, we'll come back to this. Accessibility. What live video does is to make health advice accessible. And it's basically easier than actually going somewhere because it's live on your desktop and you can get involved. Education and training. Live video is a great way, whether it be a conference or anything of that nature, then education and training, live video is a perfect fit. Patient engagement and empowerment. We're talking about not having to go to the doctors, not having to travel there, not having to sit in the surgery, not sitting in the waiting room, and then not having to travel home again. You can visit your doctor virtually using live video. It's encrypted, it's totally secure, and it gives you the power to reach out to your doctor. It's going to make a, I was going to say heck of a change. I'm going to go with that. Heck of a change to where medicine is dispensed, and you will be able to contact and hopefully make it easier for you to get an appointment, because a lot of, I don't know, I better not go there. It's helpful to us all to be able to talk to our doctor. Continuing medical education, either within an institute, like a teaching hospital, or within universities or schools, live video is a great way to do that. If we talk about that for a moment, the ability for a doctor or a medical professional to broadcast into a classroom has not been utilized to its best yet. And it is now possible for healthcare professionals to actually broadcast into the classroom. If you've got examples of this, then please do share. Continuing research and collaboration, teams from around the globe can actually get together and can collaborate. Right, I'm just going to do a run through of what we've been talking about today. And again, if you have any questions, please come back to me. We've been talking, I'm broadcasting from OneStream Live, my favorite live broadcasting system. We've talked about the benefits of live streaming in healthcare, enhancing patient education and engagement, facilitating remote consultations and therapy sessions, hosting live Q&A sessions with healthcare experts. There are challenges. Privacy is a major challenge, but the HIPAA compliance document basically sets out exactly how the healthcare professionals should be in contact with the public. Technical considerations, we've talked about cameras and microphones and lighting, and probably use of a green screen and backdrop. Best practices for engaging a live audience. If you're using OneStream Live to broadcast to your website, then basically you need to have visuals to actually show people. And if you're, well, tell your audience you're actually going to show them, is what I'm going to say. Live streaming for health and fitness. We just had a look at FruitSheFit and their use of live video on YouTube, talking to clients, video testimonials, video training lessons, all done by Matt Frucci and his team, and tips for creating dynamic and informative live workouts. Basically, yes, I've hopefully covered quite a lot of that, but dynamic is to get people involved, and that would mean having a camera in the studio. Now, I know something which is under wraps at the moment, but I know how that could be done. Yes. You can monetize your fitness sessions. FruitSheFit is chargeable, and it's a combination of in-person training sessions of 30 minutes and video on a regular basis on social media in private groups. Building an online community around your expertise. Basically, as far as that's concerned, what you want to do is to bring people under one umbrella. I'm not talking about doctors and patient consultations here. I'm talking about health fitness, to bring everybody into a group. FruitSheFit have groups on Facebook. That's the way they run it. People who go to the centres in Devizes and in Marlborough and in Chippenham are all in the same group, and it allows people to talk to each other, and it allows them to talk to any of the instructors as well, because in the group is the CEO, Matt Frucci, and the trainers, all of whom are highly qualified and highly personable and approachable, because that's the whole ethos, that as a FruitSheFit client, you're going to get total support and your questions answered. So this has been Stephen in wonderful Wiltshire in England, talking about live streaming in healthcare, the benefits and challenges. If you have any questions, just ask me. I'm in my interview studio. I'm setting up for the interview with Matt Frucci. I wish you well for the rest of your day. Thank you for watching. Take care and watch out. OneStream is on the move. That's all I'm saying. Okay. From Wiltshire in England, bye from now. Take care, and I'll see you all again soon. Goodbye. And let's leave with the card and replace. And I have been talking about healthcare goes live. We talked about the medical profession. We've talked about fitness as well. Thank you for watching. Goodbye for now.